Diagnosis of gestational diabetes mellitus. That diabetes which is created because of the gestational condition. So the lady was not diabetic before pregnancy, but she gets diabetic during pregnancy. So that is gestational diabetes mellitus. And how do we diagnose that condition? Now, it is very, very easy to remember. Just remember it on your fingertips, okay? It's very easy to remember it on your fingertips. Why am I saying fingertips? Because you have 5 fingers and we start with 5, okay? And then it is 5.5, 6, 7, and 8. So you have the diagnosis on your fingertips. It is 5, 6, 7, 8. Now, what do we mean by 5, 6, 7, 8? It means that the fasting, you remember this lady from the last video? She's going out to check her fasting blood sugar levels. So, the fasting plasma glucose of 5.6 is diagnostic for gestational diabetes or a 2 hours plasma glucose level. Now, what is this 2 hours? It is 2 hours after we give her 75 gram of glucose to drink up. We know this is the OGTT. So, we have the values on our fingertips. It is 5, 6, 7, 8. 5, 6 for this lady who is walking out of her bed for her fasting blood sugars, and so it is the fasting 5, 6 and 7, 8, that is 2 hours after we give her 75 gram of glucose to drink. So diagnosis is done on your fingertips. We start with the fingertips 5, 6, 7, 8. So 5.6 millimoles per liter for the fasting and 7.8 millimoles per liter for the 2 hours plasma glucose level. So value anything which is this or above is diagnostic for gestational diabetes mellitus. Now we have to ensure once we've diagnosed her on our fingertips, we have to ensure that we have a joint. You see, who are these two people who are shaking hands? One person is from the diabetic clinic and we have the antenatal care provider. So the antenatal care provider and the diabetic clinic person should have a meeting with each other within 1 week of diagnosis. It's very, very important and it is written in the NICE guidelines specifically that there should be a review with the joint diabetes and antenatal clinic within 1 week. And how are we going to manage this patient? Now suppose if the fasting is somewhere below 7, we know we have it on our fingertips. 5.6 was the value which was diagnosing it, but if it is below 7, we can give her a trial with maybe a 30 minutes of walk after a meal, or we can give her food with low glycemic index. We can try this again for 1 week or 2 weeks. That is why I've given all these 1 week things together in a single horizontal row. So within a week, we have this joint clinic, and for 1 or at max 2 weeks, we can try for a diet and 30 minutes walk after meal. So lifestyle changes and diet changes. That is what we can try for maybe a time of around 2 weeks. If the fasting is not very high, somewhere less than 7 millimoles per liter, but after 2 weeks, if the diabetes is not controlled, then we have to shift to metformin or insulin, whatever is indicated or possible for the patient. If she's intolerant to metformin or metformin cannot be given for some conditions, we have to give her injection insulin. Otherwise, if she is controlled on diet and lifestyle changes, then very good. we will continue like that. So this is the diagnosis of gestational diabetes mellitus and how we'll go about the treatment after we've diagnosed the patient with gestational diabetes mellitus. Now about the labor and post delivery targets we will discuss in the next video.